Out of every 3 Nigerian men, 1 will have high blood pressure. So if you look around how many people are in this hall now, that study has not failed. Even in a clinic, we see it. If we have 3 persons coming in for malaria or whatever, when we check, 1 person will have high blood pressure. And we'll start having to beg him to, give it attention. So please, for hypertension, early check is the rule. If it's not giving stroke, it may be giving other issues like heart attack. I'll move on to talk about stroke. Stroke is a sudden burst of a blood vessel in the brain, or a block of a blood vessel in the brain. And the risk factors are hypertension, of course, diabetes, stress, and even cholesterol, bad fats in the blood. These are risk factors for stroke. Like I said, the most common disease that causes stroke is hypertension. But let's remember diabetes also that causes stroke is hypertension. But diabetes can also be a risk factor for having stroke. High cholesterol in the blood can also be a reason for having stroke. And then, of course, stress too. So please, checking your blood pressure is the beginning. Don't wait until you have stroke. It's difficult to manage. It depends on which vessel in the brain is bursting. Some persons have had stroke and they've died. They didn't wake up. Others, one part of the brain is affected. You see weakness of the arm, or weakness, of both one side of the body, slurred speech. The person may not be able to talk well again, drooling saliva, and many other complications following stroke. And of course, there's no direct medical treatment for stroke. You wait for the to recover when it has happened already, giving some medications and physiotherapy and all. So why subject yourself to becoming a vegetable, bedridden, when prevention can be done? In short, it's the easiest thing to prevent. But it's still the commonest ailments that gets men, to lose the value and the joy in life. So please, regular check. Visit the hospital. If you don't like hospital, visit the pharmacy. Anywhere you know blood pressure can be checked. Check your blood pressure. And if it is high, please see your doctor. It may not be medication all the way. If it's high, not too high, we recommend some lifestyle changes for you, some exercises for you that can bring it down. I'll quickly go on to talk about diabetes. That is high sugar in the blood. Somebody once asked me a question, say, why is it that sugar is causing problem? Why the body needs sugar? I say, yes. Everything in the body needs sugar, like your vehicle will need fuel. The brain needs sugar to think, the muscles need sugar to move and all. But once it's too high in the blood, God designed the body in such a way that if your pancreas is working well, no matter the amount of sugar you take, it is removed from the blood and stored in the liver. But once there's a problem with storage of sugar, you have diabetes. This question has come over and over. I have diabetes and I don't take sugar. Taking sugar doesn't cause diabetes directly, although it's a risk factor. But it doesn't cause it directly. And that's why some persons will tell you, I consume a lot of sugar, I don't have diabetes. You're actually mounting up the day of evil for yourself, even though it doesn't give you diabetes now. It may now cause you to have obesity and some other risk factors that may now make you come down with diabetes. So diabetes is that the body cannot handle the sugar you put in the blood. And that's why management is telling you not to eat some certain food. Almost everything we eat is actually converted to sugar anyway. So the question is, if they are converted to sugar, why are you telling me not to eat this or that? Some food items have what we call high glycemic index. It means as I consume them, they are going to be converted to sugar immediately. And once they are converted to sugar immediately, it means my blood, since I have diabetes, will not be having an issue of handling them. So we recommend food that actually would be converted to glucose gradually. And so that's where the basis of diabetic diets came about. Most of the diets we recommend at the end of the day are carbohydrates, but they are low glycemic index carbohydrate food. So what are the symptoms of diabetes? Most people don't know they have diabetes until the complications set in. And the earlier you discover that you have high blood sugar in your blood, and to manage it, the better it is. Urinating frequently, always thirsty and wanting to drink water. You are getting tired and feeling dizzy all the time. And then when other complications come in, you notice wounds that don't heal fast. And then, of course, erectile dysfunction. Most men lose their potency due to diabetes. And of course, it can cause stroke, like I said. It's a risk factor for stroke. So regular check, especially when you have a family history of diabetes, always go check your blood sugar level. The next thing I want to talk about is heart attack and sudden collapse. The arteries supplying the heart gets blocked. Remember, stroke is the arteries in the brain that whether get blocked or get burst. Heart attack, the arteries in the heart itself gets blocked. And what are the symptoms of heart attack? It will give you signs. So if you're having pain in the left side of your chest, gripping, painful pain, sometimes it will go to the neck or to the left shoulders. If you have had that once or twice, please visit the hospital for a check. They will do several tests for you, check your cholesterol level, check your blood pressure, check your sugar level, do chest x-ray for you, and ECG, of course. So if they find anything there, they attend to it. Because heart attack is very deadly, especially in this part of the country where we really don't know what to do. If somebody collapses here now, the next thing everybody wants to do is to pour water. Pour water. And for heart attack, the time of response matters. As you are pouring water, the person is gone. Because if the heart stops working, life has gone already. So here too, prevention is actually better than cure. So if you check that your cholesterol is high, you bring it down. Hypertension, smoking, and alcohol, these are risk factors for heart attack. And stress too. Stress came here again. We'll talk briefly on how to manage stress. So if you're having chest pain, all of a sudden you are sweating, all of a sudden you are breathless, and you can't describe the pain, nothing else will work for it. Pain relief will not work, please. At the next available time, just visit the hospital. Now, what if somebody is collapsing before you? What should you do? Instead of pouring water, sit the person up, okay? We've seen several persons who are standing, giving a talk, all of a sudden they collapse. Some other things can actually cause collapse. Low sugar and all that, but heart attack is the one that we fear. If somebody collapses, the first thing you want to do is to ensure you give management for heart attack, because that's the one that he may not wake up from or not survive from. So sit the person up and then do chest compressions. How do you do that? You put your two hands on the left side of the chest. That's where the heart is. And you go pressing with all your power, as fast as 100 times in a minute. You do 30, then of course you have to give a life-saving breath. If you have a face mask because of probably you are scared if you get infection from the person, or if you have an handkerchief, put over the person's mouth. Bend the neck, because if you are just that the time is short. Maybe next time we'll do practical demonstration on how to give CPR to a patient who has heart attack. So you bend the neck so that whatever breath you are putting can pass. If the neck is bent this way, even if you are giving breath, it's not going into the chest. So you raise the chin up and then give in like 3 breaths and then continue pressing again for like 30 times, giving like 3 breaths. While you are calling for help, you do that. And then there are 2 drugs we must have in our pockets. It may not be for you, but for somebody else. They are not expensive. Wait, if it expires. Okay. All right. I may use somebody as an example here when I'm done to teach us how to give CPR. So there are 2 drugs you must have in your pocket. It may not be for you, but for someone. In this book I have now, I have 2 tablets of aspirin with me. In case anybody falls, nobody will fall here in Jesus' name. So aspirin is life-saving. Okay? 2-3 tablets. You can crush it into powder and put in the person's mouth. Then nitroglycerin. You go to pharmacy, you get it, nitroglycerin. Just 1 tablet put under the person's tongue. These drugs, what do? Like I said, the heart vessel gets blocked so that blood is not able to pump, and that's what causes heart attack. This drug, what they do is to go and dilate, expand the blocked blood vessel so that the blood can continue flowing again. While you do your CPR, you do all this, and the next if the person doesn't respond, about 30% of people who have heart attack, even with all this I'm telling you, will still die. So if 10 persons have heart attack, no matter the expertise you have as a medical personnel, about 3 of them will still die. So we are going back to prevention better than cure. Let's prevent heart attack instead of waiting until you or somebody close to you collapses. Risk factors for heart attack: unhealthy diet, refined carbohydrates, fried foods, excess salt, excess sugar, energy drinks, lack of exercise, smoking and alcohol. Of course, if you have a family history of heart attack, that one, prayer will deliver you from it, because you really can't change the family from which you come from. But it's been shown that if someone in your family has had a heart attack, you are at risk of having a heart attack. And of course, if you ignore checkups, you are at risk of having heart attack. When we say exercise, I saw the men doing exercise this morning. That was a good one. It's a good one. Let's clap for ourselves. And I just hope that after this conference, when we go back home, we will continue doing exercise. Let it not end here in this conference. At least 30 minutes a day, do exercise. And when we say exercise, something that will make you sweat, something that will make your heart rate increase for like 30 minutes. It may be dancing, it may be jogging, whatever it is that would increase your heart rate, you are moving, if it's any form of exercise, and you sweat. 30 minutes, 5 times in a week will save you from heart attack, while of course avoiding unhealthy diet. Let's avoid refined carbohydrates, all the energy drinks, I'm not going to call any brand here because I hear they sue people, but we know them. The bottles we buy, they are sweet, you open them and you drink. The adverts they give to them is so strong, but they are our greatest enemy. Instead of frying your food, please boil them. It's safer. Reduce sugar, reduce salt. I don't expect anybody here to be smoking and taking alcohol, but in case you are doing that and you are not stopping because of God, for your head's sake, stop smoking, stop alcohol. Then, here again, a risk factor is stress and poor sleep. Yeah. Studies have shown that most Nigerian men, of course, men generally in Africa, they are stressed and they hardly sleep because they are struggling to make provision for the family. But remember, your family needs you alive. Jesus has died for all of us. Don't die for anybody. So please, when I say this now, some of us pastors, they keep asking me, how can you say I should sleep 8 hours? But that's the prescribed. You plan your time. You'll be surprised that you can sleep 8 hours. Most things we do with our time not sleeping are actually not so important. Scroll your phone, you're on social media, you are gisting or visiting or talking with a friend. Manage your time well. The things that are not important, keep them aside. You can sleep. Studies have shown that men who don't sleep are actually prone to having heart attack. Men who are always stressed, practice how to relax. The whole world is not collapsing on your head. You have not paid children's school fees. There's no food on the table. Your heart is racing fast. Your blood pressure is going high. The Bible said in the book of Matthew, say, which of you by thinking can add a cubit of hair to his head? So the stress we give ourselves for the things we want, really, it's not even solving the problem. Science is telling us again, re-emphasizing what the scripture has told us, that when you stress yourself, when you are worried, when you are thinking about the basic necessities of life, you're actually exposing yourself to increased risks of having heart attack and cutting your life short. And of course, when you die, the very family you are worried about, they will continue. They will not enter the grave with you. They can only cry and weep. And of course, they want to fall inside. Somebody will pull them back. And when they bury you, they won't stay there. They will leave. You'll be left alone in the bush, in the grave. And life goes on. So please, let's advise ourselves as men that when you die, these very same persons, including me, is we you are worried about, for the women and the children, that we may feel pain for a while, but after some time we have forgotten and we have moved on. We've moved on. I want to stop this one here and go to prostate cancer. So in summary, what I've said now, prevention is possible. So why not work on prevention, please? Control your taste. You must not take sugary drinks, must you? You mustn't fry your food, boil them. This thing you are saying you cannot do, by the time you have, God forbid, your enemy has stroke, you'll be wishing you had started earlier. At that point, it's irreversible. You can't go back in time. So now that we are all sitting here healthy, now is the time to start. Now it's time to say, I'm going to stop eating unhealthy things. I'm going to stop taking refined sugar. I'm going to stop taking alcohol or smoking. I'm going to stop eating fatty things. I'll concentrate on natural boiled food, fruits, vegetables. Now, there's something I actually want to tell us here that in most of our men conference, of course, I've heard the preaching on natural ginger and all that. They work. I'm not here to tell you they don't work, but you know the problem is they're supposed to help you build your immune status, right? Waiting for the day when probably an attack will come. It helps you prevent them. But when it has already happened, they hardly work. They hardly work when the problems have already started. So take those naturals now while you are healthy so that you don't go down. I think that's the word on that. So more vegetables, more fruits. Once somebody has a heart attack, fruits and vegetables will not help you. If you have hypertension already, have stroke already, fruit and vegetables won't help. But now that you don't have them, fruit and vegetables can help you. Okay, eating right, doing exercises, stopping smoking and alcohol. I've seen many of my patients. It's only when they're on the wheelchair they'll tell you, okay, as I'm taking history, when last did you smoke? You say, now, when the sickness starts. That's when he stopped smoking. When last did you take alcohol? Last month after I get stroke. That's when they remember they will have to stop. Please manage stress. Rest well. By all means, rest. By all means, sleep. All the studies that have been done shows that most people who have stroke, have heart attack, and all the complications are people who don't rest and don't sleep well. Let's break this circle of sudden deaths amongst our men. Make lifestyle decisions and changes now. Get your blood sugar and blood pressure checked today. So as we are living here, if you've not checked your blood pressure or your sugar, in the last 1 month, please visit the Jehovah the Doctor stand. They can do it free for you. They can check your blood sugar free. They can do your blood pressure free for you. Yeah, I expected that. A round of applause for our mother, Dr. Lizzie Johnson Suleman, for making that possible for us in this conference. Thank you so much, ma. I was supposed to, I don't know who would make himself available for me to demonstrate what to do when somebody collapses. I'll quickly do that before I go on to prostrate health. Okay, our Reverend said we should use it. Come, you will assist me. Let Reverend come. Thank you. But sir, you will have to follow. You have to collapse. All right. Yeah, where everybody can see. Maybe just slide down. Collapse to this side. Yes. Collapse this way.
I'm collapsing. If I fall, you won't.
Help me. Now, wait. He has fallen. What do I do next? The first thing I want to do is to raise him up. Let's raise him up. I raise him up to a sitting position. I'm going to check his pulse. So, you have to learn. You should check your pulse as you are there. You have to learn how to check your pulse. If you put your hand in this radial aspect of the arm, here where my arm is, you'll be feeling a beat. Something will be bouncing and moving your hand. That's the pulse. So, put your hands here. Can we see? Can you see where my hands are? Okay. Yeah. So this is the radial aspect of your arm. The radial artery passes through here. If you will feel your pulse. If you don't feel your own, you tell me, I can come and help you place your hand. You will feel something. That's a pulse. You have to learn what regular pulse is, because if you are going to about having a heart attack, this pulse you are seeing here will not be moving. It will not be beating regularly. So sometimes it will beat, and sometimes you will see a missed beat. If you feel your pulse and you're noticing that it's not regularly beating, that sometimes it disappears, sometimes appears, that's a risk factor for heart attack. So what I'm doing now, as I put him up, I'll check.
That's a no pulse. I bet check where. I say, I am pulseless.
It's there. So when I feel his pulse, the next thing I want to do is to give him my aspirin. Remember I told all of us, carry aspirin in your pocket. 3 tablets. If his pulse is there, I put aspirin in his mouth. Nitroglycerin, buy it. Have it handy. You will save a life one day with that. Put nitroglycerin under his tongue. Now, he has collapsed. What it means, I will give Reverend an award. He's a good actor. He has done this. It means the pulse is not there. This guy is going. So what I'm going to do now is to do a CPR for him. I'm going to use here. Okay, because this is where the maximum place where weight can enter is actually the base of the palm of your hands. So most times we do this. Sometimes you can do this too. You use all your power and
press away. Press it very well.
So you kneel beside your patient and then you do this with all your energy.
I don't wake up.
Please, can I have a lady? Is there any lady in this hall? Please, let a lady come. Thank you. Can you fall?
Yes, ma'am.
Thank you. Now, I want to show you how you can give a kiss of life. Because once you do your chest compressions as fast and with all your energy, we are not bothered about the rib breaking, no. If the person's rib breaks and the person doesn't die, we have saved the soul. So use all your energy and as fast as possible, 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Count 30. After the 30th compression, you are supposed to give a breath 3 times. And that's what we call the kiss of life. So I'll position her very well. If she's like this, whatever breath I'm giving may not work. Because the airway in this position is not actually well positioned. No, like this. So this position she is now, the airway is more likely to accept whatever I want to do. So remember, the person we're talking about is half dead. So I'm going to press the mouth open. So I've pressed the mouth open, and then the next thing I want to do is 1. You breathe in 3 times. Yeah. So 3 times, really, 3 times. I don't have an handkerchief here. I've actually done a real.
She has a handkerchief.
Hey, give me your handkerchief. So, come here. Open your mouth. That's 3. Then I go again 30 times. I come back here with the neck. 3 times breath. I go again. Until help comes, until the person starts breathing, you don't stop. You continue that circle 33, 33. Thank you very much, ma. Thank you, ma. Now, If the person is, while you are doing that, if help comes, move the person to the hospital. But you know the sad thing, there's one sad thing I want to tell us now. Going to the hospital is supposed to help give further advanced management. But the sad truth is that 90% of the hospitals we have around don't have anything they can use to help you. There's this automatic defibrillator. What a defibrillator does is like giving a shock to the electric shock to the heart at a calculated watt and joules. So we'll shock the heart. And when you shock the heart, the earlier you shock the heart, the better. The heart can pick up again. But most times, most hospitals don't have that equipment. But we have here, a round of applause to our father. We have a defibrillator here, so nobody will collapse. But if anybody does that, we can shock your heart. So when you are rushing somebody who has a heart attack to the hospital, the first thing you're going to ask is, this hospital I'm going, can they do something for this patient? If they cannot do anything, and probably there will be no need, you just continue. And then, of course, we'll give oxygen. And in most hospitals, will have oxygen to give. We'll give the patient oxygen. Thank you very much. I want to go on to talk about the prostate. The prostate. What's the prostate? It's a small gland that is a part of the male reproductive system. Very small, like a peanut, okay? Just below, I have some pictures. I don't know if media can put it up. All right. Please, can we put up the picture that shows where it's located in the body? So it's a small gland located below the bladder. There's another picture that is clearer than this. Located below the bladder. Okay, yeah. That hand going in there is through the rectum, what we call the anus. So you can see, you can access the prostate to the anus. That's why sometimes when you go to hospital, the doctor wants to do a rectal exam for you. He wants to check the prostate through the anus because it's located, below the bladder in front of the rectum. So if you put your hand there, you'll be able to feel the prostate. It's about the size of a walnut, like I said. What's the function of this prostate? It produces fluid. It's a fluid that is a component of the semen. The semen actually has components from different parts of the organ. Prostate adds a specific type of fluid to the semen that actually make the sperms to be healthy. And it nourishes the sperm, helps in fertility, really. So what the prostate does to squeeze this fluid into the urethra during ejaculation. What's the clinical significance of the prostate? Outside this fluid it produces for the sperm and for fertility, enables procreation. If your prostate is not producing that fluid, you may not be able to produce children anyway because the sperm will not be healthy. Now, if this gland enlarges, media, can I have another picture showing a normal and enlarged? There's a picture showing a comparison. That's it. Now, that's the bladder like a cup, okay, up there. And down there is the prostate. If you notice, the urethra passes from the bladder down. There's that pipe. That's where urine passes. The second picture, you see an enlarged prostate. That pipe is no more open, it's closed. That's where urine is supposed to be passed. That's why when there's enlarged prostate, men find it difficult to pass urine. It's either the urine flow is not normal, or the urine is dribbling, or you have what we call incomplete sense of emptying, or you are urinating frequently, especially at night. Now somebody will say, why is it that frequent urination is a sign of prostate enlargement when you are telling me that it is blocked? Yeah. What happens is, because it's blocked, when you urinate, you may not be able to empty your bladder fully. There's this sense of there's something there that's not coming out. But no matter how hard you push, it's not coming out. A sense of incomplete emptying. Then what happens at night is that there's what we call bladder overflow. The bladder is now too full at night. You'll be going frequently. You will not even urinate much. You go, you come again, you go, you come again. So frequent urination at night is one of the signs of prostate enlargement. Poor urine stream, urine dribbling. You go to urinate and you see it's dropping small instead of flowing freely. And what are the risk factors for prostate enlargement? So why does this thing enlarge? Age is actually one risk factor for prostate enlargement. Once men get to 40, it starts getting enlarged. But many don't have symptoms. If you saw that picture, if it does not enlarge so much that it's actually blocking the flow, you may not have any symptom. You can continue living your life. In short, if you come safe and we do a scan and we see enlarged prostate, there's no symptom, and of course we do other tests to check if there's cancer, there's none. We just do a watchful waiting. Nobody may actually, because some persons have prostate enlargement and they live their normal life until God calls them home. But when there's a problem is when it now causing obstruction. The person can't urinate frequently. It can't urinate normally. That's when a problem comes. What are the risk factors for prostate enlargement? Age, like I said. Being of an African descent is a risk factor. It's commoner in African men. It's commoner in men 40 and above. It's commoner when there's a family history of prostate enlargement. It's commoner with men who smoke and men who take alcohol. Commoner with men who don't take healthy diets. Commoner in men who have hypertension and diabetes. It's commoner amongst men who are stressed. So, poor diet, lack of exercise, alcohol, smoking, age, being, of course, an African, it's a risk factor for having prostate enlargement. Then somebody asked me one day, what about prostate cancer? Does it mean everybody who has prostate enlargement will end up having cancer? No. In short, the origin of prostate cancer is actually different from prostate enlargement. Prostate enlargement starts from the inner capsule of the prostate, while the cancer starts from the outside. So sometimes you may see a man is having both enlargement and cancer at the same time, and some persons who have prostate cancer, but there's no enlargement. It means the person is passing urine normally. There's no challenge, with passing urine, but the person has cancer. And that's why regular checkup. Once you are 40 and above, please always go for regular checkup. Check what we call prostate-specific antigen. That's what tells us if there's going to be a risk for cancer or not. Another thing I forgot to mention that is a risk for developing prostate enlargement is inflammation. Any infection of the urinary tract, can actually cause the prostate to be inflamed. And frequent urinary tract infection, prostate inflammation can with time make it to enlarge. So if you have any symptom in your urine, I have pain passing urine, or the color of my urine is changing, looking funny, please always go for a test. If there's an infection there, it can be treated. I'll just quickly mention here too that urinary tract infection is a major cause of infertility amongst men. You know, those signs of infection that you ignore, after many years, you discover the semen has no sperm at all. And then by the time you do investigation, you find out that whatever it was that emptied the sperm was so many years ago, an infection that you didn't actually pay attention to, and now the testes are no longer able to produce sperm. So inflammation, infection can actually contribute to both prostate enlargement and can also contribute to infertility. And I think I want to use this opportunity to tell our men a message that our women sent us to you. That infertility, a woman not able to get pregnant is not always the woman's fault. Yes, greater chances are that it's from the women. 60% of the time is a female factor, but 40% of the time is a male factor that causes infertility. So don't always put the blame on us that we are the cause. When your wife is going for investigation for infertility, please accompany her, because you may just be the reason why she's not getting pregnant. And of course, not treating a common urinary tract infection that should be treated on time can actually be a cause for infertility, although there are many other several causes. Probably that will be in another conference. That's the only one. And no, there's another one too. That if you're always having one particular sex, all the time boys and all the time girls, it is not our fault, it is you. It's actually the chromosome that you contribute to us that we give to you. Like Papa will say, whatever you give to a woman, she gives back to you. Determination of the sex of a child actually comes from the man. It is the semen has the X and the Y chromosome. So, in the competition to fertilize the egg that we have, if the sperm that you give to us is a Y one, of course, we have it. Because the women, they have two X. We are not the determinant of sex. God gave us two X. The men are the ones that have an X and a Y. If you donate a Y to us, it's a boy. If you are donating an X, we are giving you a girl. So, it's 100% determined by the men. No woman actually can determine the sex of a child. It's the males. So it is the chromosome that you donate to us. So that's another message that they said we should tell you people. So don't drive your wife that she's giving you one particular sex. You are the cause. It is what you gave to her that she gave to you. I know there'll be questions on this. Yeah. So how do you increase your prostate health, prevent enlargement and cancer? Healthy diet, please. Once the prostate is enlarged already, like I said, it may be difficult to use good diets to correct it, but you can prevent it really. So, healthy diet. Eat more of, they've recommended tomatoes really, raw tomatoes, that contains lycopene, and it's an antioxidant. It's protective for the prostate. It reduces the rate at which the prostate will enlarge. Like I said, you cannot stop the prostate from enlarging, but to reduce the rate so that it does not get to the point where it not occludes the urethra and stops urine from flowing. Food that are rich in antioxidants like tomatoes, the cabbage, they also reduce cancer risks, really. Fruits like berries, whole grains. Now, when they say whole grain, like the rice, the corn, the millet. But the bad thing is that most of the grains we have around here are not whole grain. The grain has 3 layers. The one containing the vitamins, the one containing the brown, and the one containing the fiber. Most of the grains, like the rice you see that are imported and refined, they are not whole grain because they've removed the bran layer, they have removed the fiber. So all you are left with is just carbohydrates that you are swallowing. And too much of it is, but when we say whole grain, those ofada rice, those ones locally produced that have not been refined, all the three components of the grain, they are still intact. That's very healthy. It actually prevents enlargement of the prostate. Food that are rich in omega-3, mackerel fish, sardine fish. But it's sad to say we've been informed that because these fish, they are imported, most chemicals they use in preserving them are not safe. Oh, I don't know whether, okay, it's we women that have noticed, men will not know, that the chemical they use in preserving dead bodies, that's what they use in preserving fish that they import for us now. You leave that fish for days, it will only melt and become soft. It will never rotten. That chemical is dangerous, so please, we can look for other sources of river fish. But those imported ones, they are not healthy. Limit red meat. Those men who love bush meat, goat meat, cow meat, red meat, is a risk factor for prostate enlargement. So limit red and processed meat. Limit the way you eat fatty food, fried food, fast food, meat pie, egg roll. Here, sugary drink is coming again as a risk factor for... What are you going to be eating? Natural food. You came from the village. There's yam in the village. There's beans. There's some fada rice in the village. What else? There's fruit and vegetables. There's gari eba from the village. Those ones, they are healthy. They are valuable. Okay. Now, regular exercise actually helps in reducing the risk for prostate enlargement. So whatever exercise you think you want to do, swimming, dancing, at least 5 times a week. Avoid smoking, limit alcohol. You know, they say limit alcohol. Huh? Limit alcohol, avoid smoking. But alcohol is not good anyway. No limit. I will say here, on my own stand, though, not medical authority, stop alcohol as you are stopping smoking, not limit it. Then stay sexually active. That's what we've been waiting to hear. If possible, stay sexually active. If you are not a celebrate, stay sexual, because it's been discovered that regular ejaculation may, see the word here is may. Regular ejaculation may reduce the risk of prostate enlargement and prostate cancer. But if you are a celebrate, you are a priest, you are called not to marry, don't bother. It's not compulsory, it's advisable. All right. Control your other health conditions like diabetes and all others. Control hypertension if you have, your sugar. If there's infection, treat them. And then get adequate sleep. Here, adequate sleep, reducing stress, actually reduces the risk for prostate enlargement. And go for regular check, please. So, in summary, eat smart, stay fit, avoid infections that can actually increase the risk for prostate enlargement. I'll stop here and take questions. Thank you very much. there are no questions, it means I've done very well. They should clap for me. Who is passing the mic? Who is passing the mic, please?
Thank you, Doctor. I have two questions. The first question is, why is it that pastors give birth to girls more? One. Yes. Number two, how many times is a man supposed to have sex a week?
Hallelujah. I told Pastor Yare that I know I'm going to be on hot seat here today among men. It's okay. Now, why pastors have more females? That I can't tell. Although there have been theories that maybe they are busy and probably they don't know how to meet their wives at the right time.
Doctor man, I want to plead, there are some questions, if they come, we can keep them for the father. You understand what I'm saying? There are some questions, some people may ask you questions meant for the father here. So when they come, we'll just advise we keep those ones for the father. I don't know if you understand me. Yeah, because there are some questions that only the father or mother can answer. Because the questions are coming. I'm just trying to put preventive measure so that you can be safe.
Thank you very much, sir. I'm protected. All right. The second question Pastor Hilary asked. What's the second question? Yeah, we recommend at least 3 times a week. 3 times a week. No, wait now. Let me explain something to you. When we are investigating infertility, the questions we ask the men, first of all, is how many times a week do you meet with your spouse? If it's less than 3 times a week, the first treatment we'll give to you is go and do as we prescribe, at least 3 times a week. That's what's prescribed. I hope I've done justice to that. Then I have a written question here. It says, instead of pouring water on a person who have heart attack, which is wrong, how do one know someone who has heart attack? I just explained to you. Any sudden, it's better to be over careful than to leave someone to die. Even though as a medical personnel, once I come around somebody who collapses, I will know whether it's heart attack or not. But for the general population, you cannot precisely know if this person's falling is from low sugar or from heart attack. Like I said, the first thing you can do is put your hand in the radial pulse. Then the next thing you should do really, check the person's blood pressure. But you may not have the equipment to check blood pressure. So give the person aspirin, give nitroglycerin, and then move the person to the hospital. If they get there and they find out that it was not heart attack, you have not done wrong. You will have done wrong if you didn't do anything, waiting to confirm, and the person dies. Because that's the question here. How do you know someone who has heart attack? Any sudden collapse in somebody who has been well, particularly the person has been well, the person has not been sickly, and all of a sudden it collapses. Suspect 90% of the time heart attack. and do as we said. The second question here is, what's the difference between sugar and glucose? For the purpose of this teaching, there is no difference between sugar and glucose. The complexities, chemical complexities surrounding differentiating sugar and glucose, the one that actually digests faster and all that, wouldn't help you. If you notice in our test, we say fasting blood sugar. Some call it FBG, fasting blood glucose. There's really no difference, whoever brought that question. Thank you.
I have a question here, ma'am. If you are not sexually active, not even 3 times a week, but maybe a whole month, you are not sexually active, you are just perhaps replacing it with lovemaking. Is that okay to overcome prostate enlargement?
Okay, now, if you are not sexually active, if you are making love and you're ejaculating, whether it's sex or not, now, because the protective effect that sex has is the ejaculation itself, okay, lubricating the prostate. So if there's no actual penetration, no actual sex, but there's a love making and there's ejaculation, you are protected.
Thank you. The last one. Are we saying that blood pressure does not really have any symptom, as it is called silent killer?
Yes, sir. Most of the time, it doesn't give symptom. But when it does, it may give you a headache, like I said. But most times, if you are waiting for a sign of hypertension, you may not get any. It usually may not give you any symptom, unless it has started damaging some organs. For instance, now, if the blood vessels in the brain have started dilating, that's when it starts giving you headache. Complications have set in already. Okay? But ordinarily, your blood pressure can be going high and there are no symptoms. And that's why it got its name, the silent killer.
Hallelujah. Please, some of the questions we ask here, we want to plead and advise that she's the head of the medical unit of our medical center. You can just find time, book a period with her for a consultancy. So you can exhaust some of the things, look for an available time, so you can enjoy this opportunity that you are here if she's around. I don't know if I'm saying something, because some of your questions are heavy, though it will help all of us. But I'm only counseling that if you have certain things, you can go and meet her. Like a question that says, can a woman that does not see monthly menstruation nor ovulate monthly be able to get pregnant even with healthy sperm? What should the husband do after failed IVF?
After failed IVF?
Yeah, IVF. 6 IVF.
Wow. I think the person should come for prayers. You should see our Father in the Lord. The person should come see our Father in the Lord. I don't know where the IVF was done, and I don't know what type of, because there are different stages of IVF. As a natural IVF, there are sometimes we do direct ICI, direct introduction of the sperm into the egg in a test tube outside the womb. So I don't know what type of IVF was done. There are several stages of IVF. The cheaper one is, okay, you do a natural method of IVF. You can go further to harvest the egg from the woman, put them in a test tube, and under microscopic guard, insert the sperm. After the baby starts growing, you take it back into the womb. Others will call, there are different type of, I don't know what type of IVF person's done, but if you've done the right type of IVF and it's still not working, we have a Father who does have grace for miracles. I think you can come see.
So what is the full meaning of CPR? Please, there is a strong recommendation which is already available on Saturday, like Dr. Udoka said, there's Jehovah the Doctor, where matters that has defined medication will be corrected. Please, what's the meaning of CPR?
Cardiopulmonary resuscitation. That's the meaning. And that's what I just demonstrated. The full meaning is cardiopulmonary resuscitation. Cardio is the heart, pulmonary is the lungs, resuscitation is to wake the person up. That's the full meaning.
Okay, someone here is writing, how can I donate Y chromosome to produce a male child?
Well, God determines that, but studies have shown that if, not concrete studies though, there are still hypotheses that if you meet with your wife during the ovulatory period, that it's most likely you may get, because the Y chromosomes are actually faster than the S chromosomes. So if you are meeting with your wife when the eggs are already being released, chances are that it is the Y chromosomes that will go. Those are the hypotheses that have come in. Ordinarily, it is God that actually selects which of the chromosomes you have, because all of them are in millions. The S and the Y mix together. The one that travels first and gets into the egg is the one that wins. So if it's the X, it's a female. If it's the Y, it's a male. But some hypotheses have come up that if sex happens during the ovulation period, when the egg is already released, since the Y chromosome is faster than the X, most likely it's going to be a male. That's the best to which. The other thing you can do, which science has brought, is do IVF. We can actually pick the Y chromosome for you if you come for IVF. Select, if it's only males you want, we'll select all of them males for you. Triplets, males. It's possible. If it's only females you want, just pay us some money. We'll select all the females for you. Once you pay the cash, science has made things easier. Once you pay the cash, you can actually select the sex of your child. Not blindly anymore. Thank you.
Thank you, ma. Before I go through here, there was a question Dr. Adebayo asked concerning, and you said you gave him an answer, that the most important thing is for you to be able to ejaculate. And I believe lovemaking is penetration. And if you say, I'm coming, ma, because if you say the most important thing is for you to ejaculate, then it means there are some persons who will take it in another way around. Masturbation is not the right thing. So there are some who can masturbate in order to ejaculate. So I think you need to throw more light in that aspect so that people don't say any way is a way.
Sir, thank you very much. I want to stand protected by my father's answer to a question during the women conference. I didn't say go masturbate. He said, whatever you do with your wife in the closet, it's not a sin. The question he asked me was, you make love, and I expect he should be with his wife. Thank you. So if you tell your wife in your closet, whatever you do, I'm protected by my father here.
Thank you, ma. You have answered it well. Let's celebrate her. Hallelujah. This one says, what are the signs of prostate or enlargement? What are the signs?
Yeah. I've just told you the only sign you will get from prostate enlargement, unless it's a turn to cancer, which you may now, because prostate cancer can actually spread to the bones and start destroying the bones. You start having waist pain. You think it's arthritis until you go do some tests and we tell you it's already destroying the bones. The early signs you have is problem with passing urine. Your urine is no more flowing straight. You struggle to pass urine. It's dropping, and when you finish passing urine, it's as if there's something there that didn't come out that should come out. Those are the early signs that prostate enlargement will give to you.
There is a question here. He said the 8 hours recommended adequate time, sleeping time. As in, what are the, can they break it or at a stretch?
You can break it, but sir, the best time you will get the benefit of sleep, as science has recommended, is in the night. Night sleep, 8 hours. But if you cannot get all your sleep time 8 hours at night, do more of it at night. Then the rest you can spread it out. Anyhow, just get rest, get sleep. If you are the type who can get your 8 hours straight, fine. But if you cannot get it straight, ensure at least half of it is done at night. Then the other half, you can do it at a convenient time.
Okay, ma. Another question is, how can a man determine how to give an X or Y to a woman?
Okay, I just said it that you really cannot on your own determine what goes out. It's actually the prerogative of God. But like I said, science has made something easier. We can actually carry the S or the Y chromosome from you in the lab and put in the woman and give you what sex you need. And of course, if you meet with your wife during the ovulation period, there's a probability that you may get a male. It doesn't always work. But if you want to be 100% sure of the sex of the child you want, IVF will do it.
Okay, ma. Another question here says, is it true that retaining urine for a long time increases the risk of prostate enlargement?
Yes and no. Okay. Yes, because I just said that increased infection, urinary tract infection, can actually predispose you to prostate enlargement. And what holding urine for too long does, there's a backflow of urine from the bladder down to the kidneys. And of course, the content of urine is waste products. If it stays there for too long, bacteria will start growing. So there's a risk of getting infection if you keep holding urine for too long. And of course, from getting infected, it can predispose you to a risk of prostate enlargement. It doesn't cause it directly, but if you can give infection, it can give you a risk of having prostate enlargement.
Okay, ma. I think this should be, the questions are much here, and our daddy is standing already. He said, sex of a baby, you said, is determined by the man. If the man wants if a man wants a particular sex, what should he do?
IVF. Yeah. If you really want a particular sex and you want to be sure, you don't want to leave it to probability, do IVF. If you have the money, just come. We'll give you as many of the sexes as you want.
Thank you.
It's like everybody's interested in that thing. Nobody's asking.
Thank you, ma. I want to ask one last question. Like, for example, there are some certain men who like some certain food. You're talking about balanced diet. There are men who love eating swallow almost in a whole mouth with different kind of soup. Is it also balanced diet to them?
No, it's not. It's not balanced diet. Balanced diet means eating all the various types, the carbohydrate, the protein, the vitamins, the fruits, the fibers, the vegetables. So in your plate of food, as you're having the carbohydrate, which is the swallow, let there be the beef or the chicken. I said we shouldn't eat beef, really. Let there be the chicken and the fish. Or the egg, which is the protein. Let there be fruits and vegetables, which is the vitamins and minerals. That way, and let there be water. You have balanced diet.
Thank you, ma.
I'm grateful. Thank God I survived this. Thank you very much. I appreciate our Father and the Lord and our Mother for giving me this opportunity. Thank you very much. So I'm waiting to see you people at the Over the Doctor for free screening. Thank you.
This is Omega Fire Ministries, Paris.